Welcome, everyone. I want to thank Colleen, first of all, and I will say there's a policy brief and more information about her book on the left table on going through to where the food will be later. So please check that out. There wasn't a better place to put it, but we did want her to bring it so that everyone could get more information and read it. So when we surveyed grantees ahead of this conference, we asked people, who they wanted to hear from, and the answer was very clear. People wanted to hear from other local advocates to know what was working in their region and what was making them excited. And so I'm really delighted today to be able to ask 3 New Yorkers who are working in their own communities to ensure that there not only is access to food, but there is choice and dignity in accessing that food. And so without further ado, I'll invite the speakers up. I think it's nicest if people introduce themselves. So Josie, I'll start with you and go down the line. Can you just introduce yourself, your position, and tell a little bit about your organization?
Sure. So good evening or good afternoon, everyone. My name is Josie McClary. It's nice to be back home. I was originally born in Brooklyn, moved to Rochester in 1989, so I can have a better life for my children and myself. Learned about Rochester because my older sister attended summer camp through the Fresh Air Fun program, and I'm sure some of you guys heard about that summer program. So there in Rochester, 1989, started working for Monroe County in 1995, so 30 years with Monroe County, and I am one of the original members of the Rochester Food Policy Council.
Martina.
Good afternoon, everyone. My name is Martina Santos. I came to the United States in 1979 from Dominican Republic. I got a 16-year helping West Side Campaign Against Hunger. Also, I'm a volunteer, customer, and a board member. 12 years helping also at City Harvest. For me, be in those organizations, they give me some joy to see people, how happy they living with the food when they going to get the food pantry, because nobody know over here, food pantry for New York is life-saving. It's life-saving. People have been going to the pantry like 2 pantries a day, and that saves some money. The money they save it where they going to pay electricity, to pay also internet, and sometimes they pay like the rent too. So that means we need to do this. For me, be here today, they give me confidence and they give me powerful to be the voice of my community sitting down here this afternoon.
And Josh.
I can't follow that energy, but
you can.
I'll try. My name is Josh Stephani. I'm the director of the Adirondack Food System Network. We are a coalition of organizations, about 25 right now, across the 12 counties that touch the Adirondack Park. We are the largest in terms of geography of a food policy council in the state. We have, I think, a quarter of New York State's geography actually falls in our area. And so we cover everything from agriculture to food access and food security, but also importantly environmental, because we have this big mountainous region somewhere between Albany and Canada that we call home.
So Martina, we promised that we would bring the joy and the power in this, but I do want to start with you setting the stage a little bit. You live here in New York City. You work with 2 really well-respected emergency food providers. What are you seeing on the ground, and how are these organizations having to adapt?
They feed the gap really good, because my organization, which I campaign in City Harvest, they help a lot of people, and also The food website Campaign Against Hunger, they opened 3 sites in Washington Heights, make sure the people, they save their time, also they saving money to going to pick up the food at that organization. For me, and City Harvest too, with City Harvest, I help in City Harvest with the food distribution and food demo and the food distribution, and I saw the necessity. The line is longer and longer and longer day by day. Also helping with the Cooking Matter. The Cooking Matter is the program where they helping people make the healthy recipe with the low cost, especially with the elder, how they need to eat healthy, because right now everybody knows here in this panel about the inflation. The inflation is going over here, the food's down here. So we need to find out the way how we feed all those people, make sure they get the dignity to get a healthy food in the table day by day. And nobody going to a bed hungry and skip meal like the way it is right now in the United States.
Martina, you told me that one of the benefits of having locations closer is also because fear, like immigration fears right now. Can you talk a little bit more about that?
Yeah, that happened to me one time. I went to take the train, and they have a family, they have a mother, they come with two children. I saw the mother, they let it go, the kids like 2 blocks away, and then she said, why you let it go, the kid like that? She said, because I got a fear with the immigration. And I said, okay, I'm going to take the kids and put it in the door to school, and I come back to the mother, and then she said, I got fear to going to drop my kid to school to get a food at the food pantry because we don't have we fear about the immigration. We are suffering for panic attack, we're suffering for depression, we lock down every single day. What I saw is in New York is they have a more mental illness and more hungry day by day. And the lady told me, do you think it's possible? The only thing I give it to my kids, 1 apple for me, 1 apple for my kids, and 1 apple for another one. And also, people about with the inflation with the eggs. The lady told me before I have an eggs, 1 for me, 1 for my son. And now she say, I boiling 1 egg only for me and my son, half and half. In the store in the Bronx, they selling a loose egg, like they selling a loose cigarette. What it is here? What happened? You know, they remind me when I went to the store and saw the guy, they passed 3 eggs. They remind me Dominican Republic. I said, oh my God, I'm in my patio right now. No, and that's something they break my heart. Be over here to be my boy with the community, they mean more power for me. And for the 2 organizations what I'm helping right now in the United States.
Josh, so you're based in the North Country. The area you cover, like you said, is very broad. The distances between communities are great, and you focus also a lot on supply side, not just demand side. And yet there are some real clear themes that we've talked about: immigration, cost of food. I'm wondering if you could tell us a little bit more about what that looks like in your communities that you serve and how your organization is working to address those.
Right, yeah, that's for context, maybe it's helpful. I know we're pretty far from the Adirondack Park, but you know, the Adirondack Park in its immensity, over 6 million acres, it's like more than 400 times the size of Manhattan. So when I come to Manhattan, I'm blown away by the size, but realistically, I shouldn't be as much. But our population, no dig on New York City, I'm sorry. But our population is only 125,000 people within the park itself, right? We have counties that touch the park, but year-round residents is very different. So when we're talking about supply and we're talking about immigration, it's really interesting to think about, but also act upon our organization. So for what we've seen in the North Country is not necessarily, we've actually had some, and I don't know if I mentioned this, Julia, but we've actually had some food pantries reporting their numbers have cut in half because they're fearful. Many of their clients and their guests, especially their non-English speakers, are fearful to attend that. And the one that comes to mind is Lake Placid, right? It's this international hub within the Adirondacks. But then there's also, from the supply side, thinking about agriculture, right? It's estimated 50% of the farm worker workforce in agriculture in the North Country is undocumented workers. Right, and so that is hugely impactful. And we had ICE raids, right, in St. Lawrence County, in the Canton area, so just outside the park, but also Jefferson County to the west. And considering that there's already these threats for our communities, but when we talk about H-2A visas that don't cover dairy workers, spoiler, the number one product in the North Country is dairy and beef. And so when we talk about what that impacts our supply chain, and so thinking about not only communities accessing that food, but farmers in the North Country trying to provide for their communities is a real threat because of immigration.
Great, thanks. And I think another thing we've talked about quite a bit is sort of your ability to participate in statewide groups and bring the rural perspective. And I'm wondering if you could talk a little bit more about, like, you know, already there's some clear differences in common themes, like in how cities versus rural areas may have problems. And I'm wondering how you sort of bring that to the forefront.
Sure. I mean, I don't think we have enough time for me to rant about rural communities. But thinking about some of our statistics, right, we're really, another interesting, I love numbers, apologies for those who don't, but thinking about the number of individuals who live year-round in the park, we have over 15 million visitors annually to the park. And so when those year-round residents who are looking to source products during the winter, I know many of folks who've come up to our Food Justice Summit in the winter have, looked at the shelves in groceries, but those supply chains just don't exist. But some of those challenges too, right? We have communities and individuals who are driving more than 70 miles, which doesn't seem like that. It's like, oh, that's an hour of driving down the Northway. Yeah, there's a mountain or two in between, so you're talking 2 hours just to get to a grocery store. And quality of produce is such a very different aspect. We have farms in the North Country, Essex County, Washington County, who are making that drive to sell to New York City, right? And because they can hit those markets, because they don't necessarily have the value markets in the North Country, but there is such express need. So you could replace food access with healthcare access, and the number of hospitals in the North Country is, who knows how many, I think an estimated 7 federally qualified health centers are about to close because of some of the cuts. So thinking about not only accessing food, but making choices about gas mileage, right? Egg prices are, I think I was up in Elizabethtown and they were like $7, $8 a dozen, which is insane given that a farm store doesn't have the ability to, a farm locally doesn't have the ability to access those markets to sell at a cheaper cost than a local cost. So, I mean, there's a lot of these different elements of rural communities. We have the same problems, they just manifest differently. And so it's very interesting because we do have urban environments within, believe it or not, Saratoga, Glens Falls, but they're small compared to just outside the park there.
So Josie, you have the unique position of both working in local government and also advocating to local government through the Food Policy Council. I'm wondering if you could give a couple examples of, talk about why it's so important to raise these issues up to local leaders and give some examples of what the Rochester Food Policy Council has done.
Sure. Thank you for the question. So, yes, I've worked for local government for 30 years, and over those years, I became a very trusted messenger and always lived in the city of Rochester. So when you boots on the ground and you are out there doing the work, and I raised my family there, so I seen the struggles, and I had to be on social services when I moved up to Rochester so I can get my feet underneath me. So I understood the struggles. So when I became the county executive chief community engagement officer, he understood, he trusted me, and I was able to advocate as if I was advocating not just for my family, but for the whole city of Rochester and Monroe County. So one of the first initiatives that I really pushed for, and I'm not sure if New York City has this issue, but I'm telling you, when I say it, it just irks me when Family Dollar and Dollar Trees and Dollar Generals come into the neighborhood, and I mean, they come like roaches and just embed themselves, but yet doing nothing as far as healthy foods to the community. So one of the first things that the Rochester Food Policy Council did was write a letter to Dollar General, to the Family Dollar, which is Dollar Tree, and really set some demands on them. And I can read what those demands were, but I just want to back up just a little bit and just give some stats. So there are more than 35,000 Dollar General and Dollar Tree stores located across the U.S. I'm going to say that number again, 35,000. That is more locations than other top 10 largest food retail companies combined. Yep, I heard the whistle. Combined, Dollar Tree and Family Dollar maintain 20 locations in the city of Rochester, which 5 of them is in my little southwest quadrant of the city. So which really pushed my advocacy, because they do not, and like I said, do not have any healthy food choices in the store. So Dollar General, in talking about the rural areas, so Dollar General is mostly in the suburbs, in our rural areas, up in Monroe County. Again, it's the same issues when there's transportation barriers, and folks just can't get to the larger food chains. They're stuck to go to Dollar General. So Common Ground Health, and Candace Williams, can you wave your hand? So she works for Common Ground Health. They showed the research that city residents want to have access to healthy foods, but many stated, like I just mentioned, that transportation is a barrier. Despite the extensive presence of these stores, few of them sell fruits and vegetables, and that's fresh fruits and vegetables. So the Rochester Food Policy Council, and here are our demands. 1, reserve space for fresh, healthy produce in all stores across the city of Rochester. Continue to engage with the city of Rochester and the Food Policy Council around access to healthy and affordable food. So again, access, right? So if you're gonna come into our community, and prominently it's in low-income areas, you are getting our money, you can at least provide a shelf or 2 with some healthy fruits and vegetables. So that our third demand was consider accepting SNAP and WIC, because you know if you're gonna accept SNAP and WIC, there are certain rules and guidelines that you have to abide by. So we was gracious enough to have the mayor of the city of Rochester, Mayor Evans, signed a joint letter with the county executive, and also the Rochester Food Policy also sent that letter. And I am proud to say, sitting here as I was standing over there listening to the first panel, that I got an email from Dollar General wanting to meet for a half-an-hour conversation on the letters that we sent. So it may not be huge to some, but it's huge to us because it's a step forward.
I mean, I think you know this, but it's an issue I used to work on, and they never answered my emails, so that's huge. I'd love to hear, Rochester Food Policy Council has had a series of successes in the last few years, and I think that the way you're structured and the way you think about membership is really key to those successes. And I was wondering if you could describe the Food Policy Council a little more for people.
Absolutely, absolutely. So the Rochester Food Policy Council is resident-based, it is resident-led. It is a 13-member, 10 of those 13 is resident City of Rochester residents. And then there's 3 administrations. So that is Common Ground, which is Candace Williams. It is the City of Rochester, and Food Link, which is our food bank up in the Finger Lakes area. And so we come from different social backgrounds, different passions, different educational backgrounds. We all have full-time jobs. We have a former farmer. We have someone that actually leads a food, is Taproot, so they do a lot of food advocacy as well. So we just have a very diverse council. And yeah, with councils, we have our share issues, and we just in our 4th year, Candace, right? And so the first year and a half, it took us just to all get along because of those different backgrounds and different passions. But once we got it, and we are definitely thriving forward.
I'll say, Josie, one thing that you helped me feel more comfortable with is that you've discussed like people move at different paces and that you're very impatient, and I'm also very impatient, and I used to feel very embarrassed by that, but I was like, oh no, that's just my role.
Yes.
Like, because I think you embrace that role really well.
Yes, and so like I said, there was many challenges, and I have to say I was probably one of those challenges because it was like, come on, chop, chop, people, there's a lot of work to do, and I'm a doer, right? I don't like to meet just to be meeting, but one of the items, again, that I'm very passionate about is urban gardens, and the city of Rochester have tons of vacant land that is just sitting there, and oftentimes they don't even tend to them. And so we had some organizations that were able to lease that land for a year, but it takes about a year before you can even grow anything, and then if they choose to take it away, they took it away. And so we definitely been advocating on working with the city of Rochester to release some of those lands permanently, to deed them over to food advocacy organizations, and then urban gardens, as far as we know, can bring community together, social, educational, and just the mental well-being. And on top of that, really advocating on getting school gardens. School gardens is another very passionate thing that I am working with now with the Rochester City School District and getting urban gardens. Just on the educational piece, we all can agree that once you train up a child young to eat from the land, they will embrace that in their older life, and they will be sitting up here next advocating for our future.
So when you bring an issue like that to the council, how do they decide to work on it?
So it's a vote, right? And we bring our passion, and we bring solution with that passion. And so we will agree to move forward, and sometimes we may not agree to move forward immediately, but there's tentacles that somehow, some way will end up braiding everything together, and we move forward.
Great, thank you. Martina, Westside Campaign Against Hunger, Equity Advocates, and many of the other partners in this room this year, along with you, obviously, successfully advocated to restore $30 million to the city budget for emergency food from, it was 20 to 51, over 50 million, let's say, to be careful. You were on City Hall steps, you were testifying in the Department of Health. Can you tell everyone a little bit more about what that felt like and why you think you were successful?
They were successful because everybody working together. Also, Westside Campaign Against Hunger, they got another partner where they make a round table. That round table, they keep fighting. We give it dignity to our customers and give it choice to how they eat a healthy food, put healthy food on the table. And for me, be part of this, be part of the city harvest, like the City Hall, they made me more confident to keep push, because this is not finished until they finish. And I feel like it's everybody here, we all raise that our voice, we're gonna continue to push and make sure all New Yorkers, they going to a bed with the dignity food on the table, not keeping a meal, not with the empty stomach like they going right now. That's what the purpose with this type of conference. That's what the purpose with a testimony with City Harvest. We need to keep push and push and push. And that's why the CEO with Westside Campaign Against Hunger, Greg Silverman, they do it day by day. And then people ask me, Martina, when I'm working on any sites, Martina, you don't have any problem because you always come with a smile over here with the face. I said, I have a problem 1,000, but my key is living in my door. When I lock my door, the problem is in my house, So I come in over here to give you joy to you because we're living in the difficult time. So when I going back home, I go with my book bag full with all those problems, with all those people with the high breaker. So I leave it outside, open my door, and leave it over there, to get a chance to think into more idea. How can I get better? How can I push better by the next day to keep helping with my community? Because I'm sitting here, I went to City Harvest. Anywhere where I go, I am the voice with my community.
Yes.
My community is not alone. It's not alone because my boss is sitting over there. He made the round table to make sure everybody got a dignity, choice, and respect, because that's the key to everything on this room. And listen, this is not finished until they finish. Keep push, because the people, the community over there, they did not crying, they screaming for help. And the gap is day by day, more and more and more. Food pantry, city harvest for people is life-saving. Okay? That's what it is for me. And I feel so happy to give it the joy to those people. And that's why, Martina, I hope God give me healthy to live in many, many, many years to keep helping my community. And I feel happy to do this for my people.
Josh, I have a question for you, but I realized that I failed to say earlier that we will be taking community questions from the audience. People will be walking around shortly with collecting your note cards, and then we will be asking the questions that are most commonly asked, probably. So don't forget to send those up. You can be writing them now, and apologies for not saying that earlier. So Josh, you're now working to coordinate groups like those that Westside Campaign Against Hunger, that Rochester Food Policy all participate in across the state. Can you tell us a little bit about what has prompted the statewide coordination of food policy councils?
Yeah, absolutely. And I also recognize that, I'm just one of many voices that have been part of this conversation. I think like Rochester Food Policy Council, SAFSA out in Syracuse, Equity Advocates, Dutchess County, there's many of those people in the room. And so what we have seen, and many thanks to NYHealth Foundation over the last few years, for really investing in the bottom up, I shouldn't say bottom, the roots at part of food policy being at the community level, right? The local action that we're all doing, and really putting the effort into lived experience, because from day in, day out, it's those community actors, those food policy councils, those coalitions, really working to advocate with the community in mind, with the individuals we're serving. And so over the last few years, we've really spent that investment, that time, building trust, right? You're right, 4 years, I think. Yes. AFSN has 5 years. We're still fighting with one another. We're not, but we're that long-term game isn't just about the solutions, it's about building that internal community. And so together, food policy councils, the 10 to 15 in New York State, plus those adjacent organizations who have been doing legislate. Community Food Advocates is here as well, right? Thinking about those organizations really pushing food policy and the need to build our own internal community, to dive into the weeds of what does membership mean to all of us, right? And who do we represent, all the way up to how do we advocate. And I think what really defines us is that approach from the roots on up, not coming from a top-down approach. Thinking about the democratic, the grassroots, the scrappiness of a lot of our organizations, and really unifying together for a shared campaign, because a lot of us have not been at those tables of power, not been at those decision-making entities from the state all the way down. And so how do we, from the community level, come together through shared advocacy, through peer-to-peer training, through building our own communities? In the long run, I think will help advance our efforts, make the louder voices, the more challenges perhaps, right? This is a room full of challengers and advocates. So how do we build that up as a community?
And so why was the AFSN chosen as sort of like the group to lead that amongst you all?
I lost at the game of nose goes, perhaps. But no, realistically, and I'm not sure, right, we're the ones to lead it, right? I think we're the ones to steward it. I think that the voices in this room have been part of that conversation. The Adirondacks, by far, we're in a very interesting perspective, because a lot of our work that we're doing on a food policy level isn't met with smiles in our legislative offices, right? We're in the 21st district, which we've had an absent representative, so that it's hard to advance policy. And so I think part of it is our commitment to coalition building, our trust that we've established with some of our partners, but also being very clear that this isn't to advance our own organization, right? I have no intention of advancing AFSN if it's not advancing every other person at that table, and also making that table big enough to accommodate all of the grassroots democratic, community-focused entities.
I'll say we're quite excited to think about everyone coordinating well together. I remember, several years ago going to Broome County Food Policy Council and Teresa saying, oh, have you heard of this thing called Universal School Meals? We're actually supporting it. And that was just like such a beautiful moment to understand that the food policy councils were already uniting under sort of like state priorities of their own accord. And so I think having a more formal structure is fabulous. It also doesn't hurt that it's in a red district. Okay, so this is a question for all of you, and then we'll open it up to questions from the audience. In this time of uncertainty, what opportunities do you see? So you have funders in this room, you have government officials, you have other advocates. How can we all support you?
No, Josh, go ahead.
Oh, no.
That's a loaded question.
It's 100% a loaded question, so I'm going to bite the bullet already. But I think it's really interesting because a lot of what we're doing, we're not only working day to day providing food or working with agencies who are providing food, but we're aimed at the long-term resilient structures. And this is very evident that the more we invest, and maybe I'm speaking to the funders in this room, the officials, government officials, if there's any in this room, to really invest not only in the emergency, the livelihood of putting food on the table, but also thinking about, okay, what happens in 5 years, in 10 years, right? Attrition happens in appliances and housing. I had a funder recently ask me, like 3 months ago, because they wanted to hear about the lived experience of what's happening on the ground. He's like, when should we have been having this conversation? I said, 20 years ago. So I think from this moment, we need to start asking that question, having that conversation we want to have in 20 years. And that's a long game, right? 4 years, 5 years. I don't know how long Whiskas has been around. I probably should know, Greg. But thinking about those are long investments in community cohesion, community and trust and equity. That goes beyond just tomorrow or a year, right? We're already at a problem if we're trying to weather the Trump fascist regime, right? Thinking about that, we should have been thinking about resilient structures 5 years ago, so we are more prepared today.
And I can piggyback off of that, Josh. Thank you for setting that up too. It's just, we focus a lot on accessibility, and obviously, to your point, Josh, we should have been thinking about this a long time ago. But to the funders, giving us that platform, right? Giving us that help, giving us that wide range, and when I say us, I mean the collective us, to not only focus on the accessibility, right, but to also on changing policies and setting laws that is not just temporary, but that can lead us to the future. Mm-hmm. So when I mentioned about those school kids, learning about school gardens and learning about the healing and the getting their hands in the soil and being able to eat from the earth, but to sustain that in years to come. We can't just stop putting Band-Aids. We got to stop putting Band-Aids on things and really advocate and work together in a tangible way, again, touching the accessibility and changing the policies and practices.
For me, I always say, hungry, they don't know party or the politician. Hungry is hungry and point blank. Kid is the future of this world. You say Band-Aid. I don't say Band-Aid. I say parch. They put it parch anywhere to cover. I hope they be more, if they say something, they do something, that's like you said, they stay maybe for 5, 10, 15 years. Not for 1 year, not for 6 years. They be more specifically, and we want something, and they hearing us, but they think they don't listen to us, They be more successful with the community. They sitting then there in that year, listen to the necessity and be working for that community. Not let the community working for them. Then they're supposed to be working for the community. And that's the way it is right now. And that's the way what I think. I don't know if I'm right or wrong, but that's the way what I think. They need to work for us. The population is screaming. Nobody hearing nothing. They do something here, they do something there for short time. We need to looking at the future to see 5 years, 10 years, and see where we're gonna get on that 10 years, because they have a lot of people suffering. Rent is high. A lot of people is outside in the street because they don't have people to live. Amen. They have also the soup kitchen, the line is longer now because the soup kitchen, they used only for homeless and for people that living in the shelter. Now it's the family member, the whole family member, they going to eat dinner at the soup kitchen. We keep pushing, but they give it something to us. We give it to them. We ask something for us, and they're supposed to listen for us.
And if I can just add, it's just something that I say often, and I'm just gonna say it here. Food is a human right. And not only is it a human right, it's a public safety issue. It is a public safety issue. And we just need to, if we are going to heal together as a nation, we have to thrive together. And we have to look at feeding our community as a human right, taking care of humanity. Simple. Simple.
Thank you. I've been thinking a lot about it as a public safety issue too, and like how you talk about it, what that means, and I think it's really tricky, but it's worth thinking a little more about. I have two pretty tricky questions to go with this, and so you may not have the answers, but I think that we have a room full of smart people here who should be thinking about these, so to give them airtime. Many times when policies are built, they serve the masses and they leave out particular communities. And so I'm wondering, in these moments, two particular communities that, have been raised in these questions are, one, immigrants. How do you reach people who are afraid to get food because of immigration? And then a separate community, very different. How do you reach deaf people who also have additional barriers? This person gives an example of people driving 2+ hours to access food that also has language access there. So I'm wondering if you have thoughts about those two.
Absolutely, I can take that one. Those are two big, major concerns. So I'm going to speak on Monroe County. So the city of Rochester sits in Monroe County. Monroe County Executive Adam Bello created our DEI department, which, as we know, is under attack, but we are not going anywhere. And we created language access. So not only is food a human right, but again, I said it's public safety, but it's also public health. So at the end of the day, we as Monroe County, when we do public announcements, we do emergency announcements, it's all done, gone through our language access devices. We also use Proprio, which is a language access app that we have them on laptops, on our cell phones, and so when we go out into in the community, I'm community engagement officer, so when I'm getting the various departments, whether it's human services, public health, out into the community, Office of Mental Health, out into the community, they go with those devices, and so they are, and it holds, I believe the last time I looked, over 202 languages. So we have the devices and the means to meet those individuals. I can particularly speak on two food pantries in the city of Rochester. One of them is it's called Rochester Hope. It's at St. Michael's Church. It's in a very challenged neighborhood, 14605, which is one of the 5 challenged zip codes in the city of Rochester. And when the asylum seekers came from New York City and came up to Rochester, that's where they went, to St. Michael's. So obviously with the uptick of ICE and all of the immigration things that are going on, yes, absolutely, they are not going to Rochester Hope or to St. Michael's Food Pantry. But we have agencies that are boots on the ground. They know who those families are. They know where those families live, and they package up food and they take them to them. I have a letter here from St. Peter's Kitchen. It's another huge food pantry and hot kitchen. that we have in Rochester. Sorry, let me just find it. And I say this because it goes right back to what you were saying. So St. Peter's kitchen was created to feed homeless, the elderly, and veterans. So this is as of August of this year. St. Peter's have been serving the west side of the city of Rochester, which is where I live, since 1982. We work to reduce food insecurities by having lunch programs Monday through Saturday. A choice pantry is open on Tuesdays and Thursday mornings, and a working family choice pantry on Saturdays. So access to nutritional food is key to social drivers of health, and we all know that, right? So here it goes. The number of meals served increased by 24% compared to previous year, with a current average of 300 to 400 daily, 6 days a week of meals that they are serving. Over the past year, we have distributed 130,000 meals, over 130. This year, pantry visits reached this is what, October? 5,675 households, meaning 926 individually, nearly doubled since last year. 40% are seniors, 30% are veterans, 96% is household. We have a problem. We have a problem. To the funders, we have a problem. And we need to handle this together.
Thank you, Josie. Josh, I'll put this one to you. How are you relaying information to those in rural areas, and what method has the most reach for you?
Yeah, it's a good question. So we're a coalition of agencies. So I don't provide direct service to individuals, but we really, one of my colleagues and one of our member organizations very fond of saying, "I don't know what I don't know." And so we really leverage our relationships with those organizations and their specific knowledge base, right, their sector, right? So I think of how one of our organizations is working directly with food pantries. I think to piggyback off of what Josie was saying about food pantries, to create better systems of information. And so, we have, if you want to talk about the nitty-gritty of communication, right, your Google groups and your constant sharing of information. But one of our biggest challenges actually is the North Country is still very much picking up the phone and calling someone when they need resources, or when a resource is passed. Like it's word of mouth, and so a lot of our systems in place are working to kind of challenge that, but there's some apprehension when you'd rather pick up your phone rather than send a referral or something like that through a social care network system or to access food. Is very much community-based. So a lot of our information is going directly through organizations as an intermediary because we are organization to organization.
Great. Here's a little bit of a lighter one. Well, I don't know if it's light, but how do you all maintain hope, stay committed to your work, and avoid burnout during challenging times like these?
To me? That's a challenge. It's every single day the challenge. We have a big challenge right now to make it more sites with the community. The people, they don't going to travel to 86. Like I said before, we got 3 sites in Washington Heights where the people going to pick up the food once a month like the 86. So we try to cover the more area we can, make sure the people, they don't travel. Because also in that travel, they be involved with the immigrants. And we want not only the people, they have people, only everybody, the immigrant, whoever, they have a necessity to food. We need to cover that necessity with dignity to our community, to make sure that community feel like it's important for us, and we try. No matter what, we're gonna keep trying. We're gonna keep push and push and push Julia, to make more sites in Washington Heights, in Queens, in Brooklyn, Staten Island, and the Bronx. Anywhere is the necessity, we need to go in over there because we have a good group, like I said, like the round table also. We're gonna be working everybody together to service to our community. Like I should say, food is necessity. And food is like one of the speaker today said, is pharmacy. Because when you access it to healthy food, that's your pharmacy. Supermarket for me is my pharmacy. It's not where I'm going to pick up my medicine. It's where I'm going to pick up my food to keeping myself healthy. Avoid going to the hospital, going to the emergency room. And that's what it is. We try to service with all the people, all New Yorkers, with the dignity. And that challenge is every single day. But we're going to continue to push and push and push until we be successful in that.
I mean, I think there's so much in that, like looking forward to what's the next step, right? A few more sites and like keeping your eye on the next thing, not the overall structure, but what's the next thing I can do? Thinking about sort of the importance of it, right? Like you said, you can't afford to give up. It's human right. And I think it's, you know, like you said, being in the round table or being in a room full of people like this gives you energy again and helps you remember that. We should end there, but we still have 3 more minutes before I'm going to go ahead, Josie.
Yeah, I just wanted to say for me, my mental health is very important to me because if I don't pour into myself, I can't pour into the community. And so I love nature. So I go for walks. I go for bike rides. Sometimes I just sit and be still. But then it's being in rooms like this when you can surround yourself with like-minded people and being creative collectively to move forward. That helps me.
I think we're all social beings, even the introverts among us, so it's important to remember that. I have one last technical question because we have 3 more minutes and I don't want to cut it short. We should have ended on that, which was lovely and uplifting. But, Josie, this one's for you. Does it make sense to have municipalities pass ordinances that incentivize healthy foods, such as dollar stores and local small retailers to have healthy foods? Sorry, that's not how they wrote it. I just butchered the question. That was me. So wondering if there are barriers or benefits to incentives versus making demands, and this person is considering an effort in their own community and would love to hear your experience.
Sure. So the city of Rochester has Rock Grocer. So it's a program where if you meet the requirements, and it is, let me see, I may have it in my notes, but it's a program where it incentivizes the store and help with promotion, if there's like refrigerators needed, signs needed, things like that that can help actually bring healthy food into your store. They will provide those items for you. And they will also put the store on the app. So if you are in, just one of those folks that want to say, where's the next healthy grocery store, it's listed there. So that's one of the good things. I know the city of Rochester is going through a zoning action plan right now when I talked about those vacant lands. So they are looking to put some code ordinance about the vacant lands to be used for urban gardens. So there is some things that is in the works. They've just not been finalized yet.
Great. Well, please join me in giving everyone a round of applause.
Please welcome to the stage Program Officer of NYHealth Foundation, Andrew Barrett.
Thank you.
All right, good afternoon. I'd really like to say we saved the best for last, but unfortunately for me, all of our speakers, everyone has set a pretty high bar. So let's please give them another round of applause. I'd like to start by thanking the rest of our amazing team at the NYHealth Foundation, in particular Julie McCarthy, Liz Ward, Erica Van Boxtel, and Dee Dee Donovan for the immense amount of work they put into making today a success. Except for this part where I was given the task of standing between you and connecting with each other and eating more food. Big thanks to our keynote, Corby Cummer, our esteemed speakers, moderators, and panelists who came from near and far to share their insights and expertise with us. The MME event team, who's been doing so much work behind the scenes, and the catering team and the staff here at the New York City Bar for their work today. Over the course of the afternoon, we've heard from state agency and nonprofit leaders, community advocates, policy experts who are working hard to protect and strengthen food access across New York. We've explored how our state is stepping up in response to shifting federal policies, how older adults are uniquely impacted by food insecurity, and how local champions are driving meaningful change in their communities and beyond. Like Josie said, healthy food is not just a human need, it is a human right. And in this moment of uncertainty and change, when the federal government is cutting funding for nutrition programs and we are now in a shutdown with no end in sight, New York has both the responsibility and the opportunity to lead with compassion, innovation, and bold action. There are incredible people here in this room today, advocates, community volunteers, nonprofit leaders, researchers, city and state agency leaders, funders, and more. Whether you are shaping policy, running programs, or organizing in your community, it is going to take all of us to meet the challenge of this moment and ensure that all New Yorkers have the food they need to thrive. We have the next hour or so to share time and food together. If you already know others here today, be sure you say hello. If you don't know someone, be sure to introduce yourself. Let's continue to build partnerships, raise our voices, and hold each other accountable, because together we can safeguard the right to food for New Yorkers, not just in times of crisis like these, but for the years to come. Thank you all so much for being here, and please join us in the reception across the hall.